Hey guys, today we're going to be doing an NG tube insertion. So first of all, we need to verify our order, and we have our order here in front of us that the patient needs an NG tube. Next, we're going to get our equipment. You're going to need tape, a stethoscope, a cup of water, some lubricant, your NG tube with proper sizing, and then you're going to need the irrigation bulb syringe. Okay, you'll also need clean gloves and your alcohol solution. So once we've done that, we're going to clean our hands and we're going to identify our patient. Hi, my name's Sarah. I'm going to be your nurse today. You have an order for an NG tube. I need to verify on your bracelet, what is your name, what is your date of birth, and what are you allergic to? Have you ever had an NG tube before? Great, so you know what the procedure slightly is. You know it should not be painful, but it is slightly uncomfortable. So I need to do a quick assessment on my patient. The things that I'm gonna assess would be bowel sounds, get my stethoscope, and listen in all 4 quadrants. And we would need to document that baseline assessment on our patient. And on this patient, they have no bowel sounds. If I were to have to confirm that, don't forget, you would need to listen in each quadrant for a full 5 minutes. Also, I'm going to assess their nares. You're gonna come up and have the patient, can you please breathe out your nose, pinch the other side, breathe out your nose, and see with air movement and which nair is most patent. You can even take a light, look up the nair that you're choosing to use, looking for any type of nasal or septum deviation. You want to ask your patients, have you ever had any nasal surgeries? Have you ever broken your nose before? Those types of things. You would also want to assess for orientation. And my patient is alert and oriented ×3, and they can easily follow commands. Lastly, we want to look at the skin of the nares, making sure there is no nasal breakdown of the skin. And with our patient, everything is fine. So we want to establish a signal with our patient. We're going to put an NG tube down. At any time it gets distressing, if you can just lift up your opposite hand with one finger to let us know that we need to stop and give you a break, making sure that the patient understands and has no issues. Next, we need to make sure our patient has a gag reflex. We need to have the patient, they can stick out their tongue and say, ah, they can swallow. We can have them take a little sip of water if they don't have a bowel obstruction, making sure that they can get the water down. Next, we need to position our patient in high Fowlers. You may even choose to remove the pillow from behind the patient's neck, making sure the patient's good and upright in the bed. You may have to help reposition them. And then also think about bringing the bed up to you. After I've touched everything, I want to wash my hands. We're going to have to put the side rail down so we can get to our patients. Wash our hands again. We want to open our tubing. And remember, this is a non-sterile procedure. We want to take our tubing and look at it, making sure there's no rough edges. There are holes in the base of it, and there are no rough edges or deformities, and this looks good. Next, we're going to measure our tube. For this, I'm going to wash my hands. Put on some gloves since I'm going to be touching the tube, and it's going to go down into their stomach. Again, this is non-sterile, so I do not need sterile gloves. You're going to take the tip with the measurement, and you're going to do a measurement of the tip of the nose to the tip of the ear down to the patient's xiphoid process. One of the things that you need to remember is once we do this for our checkoff, some of the mannequins do not allow the NG tube to go all the way down, and we are aware of that. We're just gonna insert it as far as we can. But in a real patient, we will insert it down to where we've marked the tape. So we're just gonna put a tape at our marking so we don't forget where that is at. At this point, we have measured our tape. Now we're going to get our tape ready to secure it to the patient's nose. You may work in an area that has NG secure devices, and that would be acceptable to use. So you're gonna need a piece of tape. I would recommend silk tape. This is paper tape, but I would recommend silk tape. It's more durable. You are going to get a 4 to 5 inch piece, and you will split it down the middle. And I always tuck the ends of the pants under so they're not sticking on things. And then I put it on a clean surface so it is ready and prepared for me when I'm ready for it. Now we're almost ready to insert the tube. One of the things that we're not doing in this video that you may want to do with a real patient is give them some type of emesis basin in case they vomit while we're putting this down, or put a chuck pad across the patient in case they get sick and vomit. We are going to lubricate our tube, and we want to make sure that we lubricate that tubing well. Now, one of the things that we would have a patient do, or we would have an assistant do, is as we are inserting the tube into the patient, this is when we would instruct them to swallow. So you would need a cup with a straw, and again, the patient can hold it, but it's really nice to have an assistant to have them hold it, okay? So we're ready to put in the tube. Okay, and we will walk the patient through it, instruct them as we go. So I always like to go in and kind of back towards the septum. When it gets to the back of the throat and they're starting to gag, you can give them a second to get their breath. And then this is when we instruct them, they would want to go chin to chest, okay? And your patient will put their chin down, and that helps with putting the tube in. So you would keep inserting, and like I said, my mannequin, you know, I can't hold their head and do it all at the same time, and we're aware. With this tube, they will only go in so far, and we are aware of that too. So we are all the way in that it's gonna go. Oh, there we go. Nope, we're going again. Remember, your patient is going to be drinking at this time, which lubricates the tube, which helps to put it down into the stomach. Okay, that's as far as it's going to go. Now, we need to temporarily tape, because if I were just to let this go and they were to vomit or sneeze, the tube can come out and we can lose placement. So you can choose to go ahead and tape it all the way down, or just temporarily tape it, whatever works for you. I would recommend, though, as you're taping, you don't want to tape it up against the nair, because that is increased risk of skin breakdown. So you want to come out a little bit further down the tube, and you're going to wrap, I always call them your pants, down the tubing. Okay. Make sure we've got a good secure to the nose. And now we need to check placement. So with this, we're going to need our stethoscope, and we are going to need our bulb syringe. Now, one of the things students ask me is which of these do I use? The blue piece is a vent, and if I were to push air through it, it breaks the seal on the vent and then that vent will leak. So we do not use the blue. You'll remove this adapter piece, and I like to just stick it in the blue so I know where it's at later. Put your bulb in, and then we're gonna listen over the epigastric area. You're gonna insert air and you should hear a gurgling sound. And most of the time, what you're gonna see is gastric content coming out through the tube into your bulb syringe, okay? So we have heard and confirmed placement. We would now get ready to hook this up to suction. So you would need your adapter piece and you would hook it into your suction canister tubing, okay? We need to finish securing the tape so that we know we have placement. And the other thing is I would take an additional piece, put over the bridge of the nose to help secure it, okay? We need to make sure our patient is cleaned up. If they vomited, we need to clean any extra lubricant off of their face, make sure their nose is clean, make sure the tube is comfortable and not sitting right on the skin of the patient. They may need some oral care if they have vomited. Last but not least, once we have done that, we may even have to send off a piece of the gastric aspirant or content to lab to verify that is the correct pH of the stomach. Again, that's going to depend on your facility policy. We need to get a chest x-ray to confirm placement of the NG tube before we start putting medications or anything else into it to confirm that placement that we've also verified with listening. We need to help make sure our patient is in a comfortable position. So again, if they feel comfortable upright, we would leave them this way, or we can put them back down if we need to. Making sure the pillow is in proper position for comfort. Also, we need to put the bed back down in proper position in a low resting state. Again, the patient is in comfortable position. The patient has been cleaned up. We'll make sure their call light is in reach. We are going to remove our gloves, dispose of those, wash our hands. We are going to clean up our mess, and then we are going to document the procedure that we have just completed.